Breaking news. Ebola has struck Glenview, Illinois. The horrific viral disease struck Claire Hershenhouse on Thursday, October 26th. The disease was first seen in 1976 in the village of Yambuki near the Ebola River and now has spread all the way to America. Its most recent and largest outbreak was in West Africa, killing about 11,310 people and had a mortality rate of 50%. We hope Claire can survive this disease. Let's pass it over to Maya at the scene.
Thanks, Maddie. I'm here today with Dr. Dunca, Claire Hershenhouse's doctor, to talk about the topic of Ebola. So, Dr. Dunca, how do you know if you have Ebola?
Well, Maya, there are multiple symptoms for the Ebola virus disease, including fever, severe headache, muscle pain, fatigue, diarrhea, vomiting, abdominal pain, unexplained hemorrhage, sore throat, red eyes, symptoms of kidney and liver dysfunction, and internal or external bleeding. Symptoms may appear between 2 to 21 days after exposure of the disease. The disease can be prevented by avoiding Ebola-affected areas, washing your hands frequently or using alcohol-based sanitizer, and isolating people with early symptoms and telling public health authorities.
Other ways to prevent Ebola are avoiding contact with blood or bodily functions of anyone who is sick, or contact with contaminated surfaces, clothing, bedding, medical equipment, and supplies. Never touching an Ebola victim's body, and looking for immediate medical care and limiting contact with others if symptoms are shown.
Ebola patients must be isolated and all their contacts tracked down and monitored for symptoms for 21 days. Those who recover from Ebola should abstain from sex or use condoms for 3 months.
Thanks for that information, Dr. Dunca. Now we will head over to our sick patient. I'm here with Claire Hershenhouse, who is infected with Ebola. The patient has now had Ebola for 2 days. Claire, I'm going to ask you some questions through video chat from outside the room.
Okay.
So, first of all, how did you get this disease?
Well, I'm a zoologist, so I traveled to Africa for work to examine the bats. Since bats are the most likely natural source for the Ebola virus, I contracted it from one of the bats I was examining in the outdoor lab. I went home the next day and started noticing some symptoms of Ebola.
I'm sorry to hear that, Claire. I hope you get better soon.
Thanks, Maya.
Now, let's bring it back to Maddie at the studio.
Thanks, Maya. That's a horrible story about Ebola. This message must be noticed by everyone so they can be aware of potential symptoms that could happen to them. Now we have breaking news from Maya at the scene that Claire Hershenhouse has suddenly began to recover from Ebola. What a miracle. Although Claire has recovered, everyone should be careful about what has happened and who they interact with. Thank you for listening tonight. See you next time on Maddie Cap's News.